So let's have a look at the classifications of burns. Now the classifications we're going to look at is we've got our superficial burns, our dermal burns, which we're going to split into superficial dermal and deep dermal. And then finally we have our full thickness burns as well. So we're going to start off with our superficial burns. Now superficial burns is where we get that erythema, we get that redness on the epidermis. However, the skin layer has not been breached. Okay, so we don't include it in our total body surface area when calculating the burns. Now, dermal burns, let's start. We've got the superficial dermal burns. Now, the key point with this is we start to get the blisters. Okay, so as the fluid rises up through the skin, it pushes that broken epidermis up, and then that's how we get that blister. Underneath the blister, we're going to have a nice bright pink wound, which will blanch to the touch, but will have a normal cap refill time as the circulation is not compromised. When the damage starts to protrude further into the dermis, we're looking at our deep dermal burns. Now with the deep dermal burns, we can start to get an altered sensation. We can get numbness as the nerve endings have start to become damaged as well. Now you'll notice that it's like a pinky whitey colour underneath. It will blanch, but it will have an extended cap refill time. Okay, so we've got a normal cap refill time with the superficial, an extended cap refill time with the deep dermal as it goes through those layers. Now the last one, we have the full thickness. This is where the burn has penetrated all the way through all the layers of the skin. Appearance wise, it can be white and waxy, sometimes get some charring on there as well, and they can look quite leathery. Because it's gone through all the layers of the skin, they're normally painless because all the nerve endings have been damaged.